This is Module 32, the concept of violence. These are the concept learning outcomes, or your objectives. So violence is the excessive use of force, whether it's against others or yourself, and often results in physical or psychological injury or possibly even death. The concept of violence is a combination of factors. You have a predisposing factor, such as vulnerability or the risk of being a victim. You have risk factors, such as somebody who has been in an abusive relationship or has seen an abusive relationship and thinks that that is acceptable, so it perpetuates violence on others. Precipitating factors are specific incident of violence. Protective factors connect to the community, to the school, to provide safety. But regardless of predisposing and protective factors, anyone can be a victim of violence. You have alterations and manifestations. So abuse is the intentional harm or injury. There can be interpersonal violence within relationships between family members or intimate partners. There is a cycle of violence that is deliberate, systematic, and has a pattern. So the three phases are, first, the tension building phase. This is when communication fails between the people or partners. Second is the battering phase. This is when the incident occurs. And the third is the contrition phase, or the honeymoon phase, where the person will agree to change, they promise to change, and things are going to be different. So trauma is injury to human tissue and organs. It can either be intentional or unintentional. So accidental is without intent. So components of trauma, you have to have a host, and this is the person harmed or at risk. You have to have a mechanism, source of energy, such as a motor vehicle or a gun or a knife. You have to have intention. Something such as a gunshot or a stab is usually intentional, whereas something like a drowning is unintentional. You have environmental, where you may have a slippery road that contributes to trauma, or you may have a slippery floor. Minor trauma is considered an injury to a single part of the body or system of the body, and usually is treated in a physician's office or in an emergency department. Multiple trauma is very serious injury to either a single system or a multiple system injuries. Motor vehicle crash is the most common. Blunt trauma is when there is no communication between damaged tissue and the outside environment. So somebody falls, or they're hit in the head by a ball at sports activity. That's going to be blunt trauma. Causes of blunt trauma are deceleration, where there's a decrease in the speed of an object. Acceleration is an increase in the speed of an object. Shearing is going to be slipping. Compression is going to be pressure. And then crushing can be extreme compression. Penetrating trauma, caused by a foreign object that enters the body. And other types. Inhalation, burn, or blast injuries can occur. So, genetic considerations and non-modifiable risk factors. So, it is believed that there's a genetic predisposition towards violence. It can be cofactoring environmental factors. Again, somebody who's grown up in an environment where abuse and violence is accepted may precipitate that, continue that. Cofactoring environmental factors, again, are prior abuse. X-linked gene, MAOA, there has been research that this gene does indicate a propensity of development of violent behavior, and it's thought to be responsible for a number of psychological and nervous disorders. Disorders that relate to social, mental health, especially if they are untreated. Age, typically it's during adolescence or young adulthood. Some behaviors in this age group are considered warning signs for future violence. Genetic consideration. Women are more frequently the victims of intimate partner violence, IPV, sexual violence. Men are usually the perpetrators. There are several factors that contribute to male aggression. Criminal father figure, having a disrupted family, poor parental relationships, and also impulsive behaviors and aggressiveness. Abuse prevention. So as a nurse, we need to be proactive. We need to try to prevent the abuse from happening. Nurses need to be aware of their own feelings about family violence. Trauma prevention, motor vehicle safety, wearing seat belts, child safety seats, relationships, and communities. So when you're doing your assessment, you want to begin with ABCDE. So we know that ABC is airway, breathing, circulation, but we also need to take into consideration, is there a disability? Is there an injury that is leaving this person disabled? Or E, exposure, environmental. Is there something in the environment that could be causing this, such as fire, smoke, or exposure? So an abuse assessment, a nurse is responsible to be alert for the symptoms. So your assessment interview, make sure you're providing privacy. You have to establish that trusting nurse-client relationship to make sure that the person trusts you enough to tell you what has been happening. Offer options of answering questions with sometimes it can be okay not to necessarily ask yes and no questions. The person can say sometimes it happens sometimes. Also, make sure that we're considering cultural and spiritual practices when we're doing our assessment interview. So your abuse assessment, as you're doing your physical assessment, you know what normal is. So some signs of abuse may be on the head. There may be bald patches. The skin anywhere. There may be swelling, bruising, scars, especially bruising in different stages of healing. So as you have a bruise, it usually starts out dark purple, red, gets a little bit lighter, turns a little bit greenish, yellow. So if you have bruises that are in different stages of healing, that could be continued abuse. Abdomen may have indications of bruising. Neurologic system, do they have hyperactive reflexes? Do they flinch or pull away if you try to touch them? If you suspect that there is intimate partner violence, you need to have a team assessment. So you should not be doing the assessment alone because it comes back to he said, she said. You need to get a nursing supervisor, you need to get primary care provider, social work, anybody else who is on the team to take care of that patient should be involved in the team assessment. Trauma assessment, again, we're going to prioritize with ABCDEs. Consider long-term consequences. Is it going to result in a disability? Death is a common result of serious injury, obviously. It has an effect on the family. There may be psychological crisis within the family. Assess the family for various needs, referrals as needed. Methods of assessment. Again, airway, breathing assessments, your circulatory assessment, level of consciousness, are they awake, alert? Pupillary function assessment, neurologic assessment, making sure that you're looking at those eyes if they have been hit in the head, and any obvious injuries. And again, there are scoring systems that can help you with this comprehensive revised trauma score and also the gas glaucoma scale. If you have somebody who's been in a motor vehicle accident and they're unconscious, you're going to obviously start with the gas glaucoma scale. Lifespan considerations. Children and older adults are less likely to report instances of violence, mainly because they are vulnerable. They don't want to be in a position of be the victim of retaliation. Make sure you're considering culture, no blood transfusions for Jehovah's Witnesses or the Christian Science culture. Violence is an expected element in specific cultures. Sometimes it is viewed as a value, as a right, so rite of passage. There's gang culture, there's drug culture, which often will center around violence. So what can we do for these people, our interventions? So our goals need to be, in treating the abused client, we need to empower that client to take control. We need to be supportive. We need to maximize their safety. And something that you're going to have to do is to provide quality care to not only the victim, but also the perpetrator. Nurses have to treat all patients the same, so be very careful of your own perceptions and your body language should this happen. Interventions for victims of abuse, again, determine the immediacy of the danger. Convey that the individual, the patient, is not to blame. They have a right to be safe. They have a right to be free from abuse. So you're going to help them explore their options, provide information about available resources, making sure that they have a safe place to stay. Do they have a plan to leave should they choose to return and the violence starts again? Wait a minute. Abused children. Primary consideration obviously is the child's safety. Reassure the child that they have done nothing wrong. Avoid negative comments about the abuser or the caregiver, whoever did the abuse. Follow established protocols. Per facility policy, how do you go about reporting any suspected abuse? Abuse of assault older adults, also you have to follow the facility policy and protocol. Make sure that you're developing a positive relationship with the victim and the abuser. And this is, you want to make sure that you are getting accurate information. Explore ways for the older adults to maximize their independence and explore the need for additional home care services, alternative living arrangements. Elder abuse is something we are going to talk more about that in class. Documentation. When you are documenting suspected or findings from domestic abuse or domestic violence, you have to follow some very specific protocols. You need to make sure that you are being as objective as possible when you are documenting. You need to make sure you're using quotes, what the person has told you, using their own words. This link is a link to a one-page article, 10 tips for documenting domestic violence. So please read this and be familiar with this. And that is it for this module 32, Concept of Violence.